Hello everyone, in today's video I'm going to talk about normal lymph node anatomy, the ultrasonographic findings and findings of the malignant lymph nodes. Normally the lymph nodes are oval shaped structure. So long axis to short axis ratio is 1.5 to 2. So this is important because in malignancy the long to short axis ratio will be changed. Normally the cortex of the lymph node is hypoechoic. Hilum will be hyperechoic. Central vascularity we can appreciate in the lymph node. So this is the image of the normal lymph nodes. This is oval shaped. We can see this is oval shape. It is not spherical or it is not round. This is oval shape. If you calculate the long axis dimension and the short axis dimension, and if we calculate the ratio of the long to short axis measurement, then it will be 1.5 to 2. So here we can see the cortex is hypoechoic. This is the cortex of the lymph node and this is the hilum. From the hilum, blood vessels and the lymphatic channels will enter and exit the lymph nodes. So we can appreciate the vascularity in the center. So one of the important causes of the lymphadenopathy is reactive lymphadenopathy. So in reactive lymphadenopathy, the shape of the lymph node will be oval in shape. And the cortex will be thickened, homogeneous, hypoechoic. If the short axis dimension is more than 10 mm, then we can see this is the enlargement of the lymph nodes. Generally, we calculate short axis diameter over long axis. This is the long axis dimension and this is the short axis dimension. Preserved echogenic hilum. So if the hilum is normal, then this is the feature of benign lymph node enlargement. But in case of malignancy, the central hilum will be lost. So this is the image of the reactive lymphadenopathy. The shape of the lymph node is oval in shape. Cortex is thickened, heterogeneous and hypoechoic. We can see the cortex is thickened, heterogeneous and hypoechoic. If we calculate the short axis diameter of the lymph node, then it will be more than 10 mm. Here we can see the hilum is preserved and we can see the increased vascularity in the lymph nodes. So malignant lymph node in ultrasonography appears round. The normal shape of the lymph node is oval, but in malignancy the lymph node will be round. So lymph node will be enlarged, it will be very hypoechoic and heterogeneous. So we can see the lymph node is black. This is very hypoechoic lymph node. If you calculate the long axis to short axis ratio, this is the long axis and this is the short axis. So if you calculate the long axis to short axis ratio, then it will be less than 1.5. For benign lymph nodes, the long axis to short axis ratio should be 1.5 to 2. But if the long axis to short axis ratio is reduced, if it is less than 1.5, then this is the feature of malignant lymph nodes. Here in this image, the hilum has been lost. We cannot appreciate the hilum. So if we can see the central fatty hilum, then this is the feature of benign node. If we cannot appreciate the hilum, then this is the feature of malignant node. We can see there is the peripheral vascularity. If the vascularity is increased centrally, then this is the feature of benign lymph node. If the vascularity is enlarged in peripheral region, then this is the feature of malignant node. Sometimes we can see cystic changes or microcalcification. So if we see the cystic change or microcalcification, this is also a feature of malignant lymph node.